Hello, dear students. Welcome again to Master Nursing classes. So, here in this class, I am explaining the management of the seizure. In previous class, in the part 1 video of the seizure versus epilepsy versus convulsion. So, I have explained each and everything in detail related to seizure. What is epilepsy? What is convulsion? What is status epilepticus? So, and we have studied the very important classification of the simple partial seizure and complex partial seizure. And we have studied also generalized tonic seizure. Also, we call that is an grand mal seizure. And we have studied the tonic, myoclonic, and various Jacksonian March seizure and Todd's palsy. So, we have studied all type of the seizure in detail in the previous class. And in this class, I am explaining exclusively only the management of the seizure. What is the nursing officer responsibilities while taking care of the patient with the seizure? So, what is the priority? How you will set the priority? How you will divert our question based on the the necessary and the given situation of the patient. So, how you will answer to that particular questions? I will explain in this one. So, very important. So, many students get confused where we will give to priority, whether we will give priority for airway or the fall risk management. So, I will give the clarity on that. So, how the examiner may arise the question, how you will answer for this question. So, very importantly, let me start the question and answer session and the management of the seizure. So, without wasting the time, here we will discuss first over the management of the seizure. In that, nursing management we will see. Okay, nursing management. So, see if the examiner is asking, one 10-year boy is admitted in the hospital, he is on the bed. So, when we got the seizure activity, our first priority goes to management of the airway by giving the patient sidelining position and all. But if the examiner is asking a patient who is standing in the corner and who is sitting at the end of or edge of the bed, so at that point of the time, our priority nursing action goes to prevent the fall risk injury. So, what the examiner is trying to ask, that one you understand first. See, examiner is already telling you the patient on the bed and so also side rails are also upward means so he is only told the patient is in the safe position. What is the necessary to answer the question as in priority as a first action? So at that point in time, so our answer goes to the airway management. If the patient is in unsafe section in the unsafe sides, so we'll first move the patient to the safe area. And if the patient is standing or sitting means we will ask the patient to sit down to prevent the fall risk injury. So very important. So first maintain the patent airway. How you will maintain the patent airway in patient with seizure episode? So we will provide the side lining position. So in order to prevent the aspiration and in order to open the airway, if you are giving the side lining position means so the whatever the secretion coming, the saliva coming out of the mouth will comes out, and whatever the drooling coming out of the mouth will comes out easily. So there is an least chance of the aspiration if we use the side lining position means. So first, how we will maintain the airway? We will clear the airway by providing the side lining position, and never ever and don't put anything in the mouth. In order to open airway, so you are putting something in the mouth means the patient teeth will break and tongue will get injured. So in order to prevent the damage to the teeth and tongue, so you will never ever put anything in the mouth of the patient and don't forcefully open the jaw. Okay, don't forcefully open the jaw during the episode of the seizure. Here is this your nursing responsibilities to maintain the airway of the patient. Okay, so if aura is present means. So when we assess for the aura, what is the aura? Aura is the warning signs of the seizure, where the patient is telling smell of the rose and he is telling some metallic taste. So without any stimuli means he is indicating that the seizure is going to occur. Means the warning signs that indicating the seizure episode will come now. So at that point of time, if aura present means in case of patient in unsafe place, or patient is standing, means shift the patient to safe place and ask the patient to lie on the ground in order to prevent the fall risk injury and protect from the injury. So in this case, in this situation, the priority nursing actions goes to protect the patient from the injury. If the patient on the bed and if in the safe position, means so rise the side rails of the bed and maintain the patent airways, the our priority nursing responsibilities. So the based on the given situation, our answer will change here like this. Okay, so very important. So you have to note in your notebook and revise during the time of examination is this one. So if the patient is in the unsafe or the standing position, so you will first priority is to protect the patient from the yes the fall risk, and after that, if the patient already in the safe position, so you will protect the patient from the injury by bandaging the our side rails of the bed, and will make the patient in the comfortable side railing position in order to maintain the patent airway. Okay, so the very important. Okay, and to prevent the injury during the surgery. Okay, if already sorry during the seizure, if already seizure episodes are occurring, so seizures are started. So at that point of the time, how we will prevent the injury? So wherever the restraint come in your options, first eliminate that option. So because we will never ever restrain the patient of the seizure. So we will never ever restrict the movement of the patient of the seizure. Restraints means what is the restraints? We are yes tying the hands and legs of the patient to the bed. So that is what we call the restraints. We will never ever apply the restraints over the patient of the seizure. The first very important point you have to keep in your mind is never ever restrains the patient with the seizure, and remove the hazards from the patient environment. This is the first thing what we will do when the patient comes for the admission with the history of the seizure. See, the doctor mentioned the patient is having the history of the seizure, means we will arrange such type of the bed for that seizure patient where there is no any hazards during surrounding the bed of the patient. There should be no any sharp object. No, if the patient falls, also there should be least hazardous environment that may least damage the patient. So we will remove the hazards of the patient environment. First thing what we will do when the patient comes for admission with the history of the yes the seizure, and we will use the loose clothing. So never ever entertain the tight clothing for the patient of the seizures, and we will cover the side rails of the bed with the cotton bandages. The very important to if the while doing the convulsion, so the motor manifestation patient legs may goes like this and hand may goes like this. So he may got damage due to the friction between the hand and the side rails. So in order to prevent that one, we will band-aid the side rails of the patient bed. Okay. So and don't leave the patient alone. Be with the patient and identify the what type of the seizure is occurring to the patient. Okay. So your nursing officer should, or during the episode of the seizure, he should always be with the patient until the seizure episode completes. And so nursing officer should identify the type of the seizure which is occurring, whether it is a generalized seizure or clonic seizure or tonic seizure or myoclonic seizure or tonic seizure. What kind of seizure is occurring, we have to identify that one, and don't leave the patient alone and be with the patient. This is our nursing responsibilities when the seizure process started. So okay, so this is very important. And instruct to avoid the stimulating factors to the patient. That is the very important. Instruct to avoid the stress, instruct to avoid the fatigue, and instruct to avoid the alcohol. Because of the fatigue, alcohol, and stress, there is a possibilities of the occurrence of this seizure repeatedly. So in order to prevent that one, we will always instruct the patient to avoid the stress, fatigue, and alcohol intoxication. So this is the very important. And we will also instruct the patient to never use the tub bath. Never use the tub bath. You know the tub bath. What is the tub bath? Yes. This is the tub where the patient will sit inside this one and he will take bath. If the patient with seizure is taking tub bath, means if the seizure activity occurs during the process of the tub bath, means the patient may yes go inside the water and his airway get blocks and the highest risk of the death that occurs due to the drowning of the patient in the water. So because of that, we will never allow the patient and we will instruct their family members never ever entertain the tub bath to the patient with the seizure activities. Okay, very important. And while doing during the process of the seizure, we will never ever take the oral and rectal temperature. We will take the axillary temperature during the process of the seizure. Okay, very important point. And instruct the patient to don't drive any car, bike during the if he is having the history of the seizure, because not only his life is in the risk, the others' life who are traveling in the roads may also die because of this patient. So clearly instruct the patient to avoid the driving and don't be stressful, fatigue and alcoholic. So we'll clearly instruct the patient and instruct to wear the medical bracelet if he is having any seizure episodes in the in the any airports and in the is there any airlines and in the railway stations, bus stands means someone, some medicos or else some common people may understand this is the case of seizure and they will ship the patient to yes, any near hospital. Okay, so it's very helpful to ask the patient to wear the medical bracelet. So this is what the nursing responsibilities while taking care of the patient with the seizure. You will see the the medical management of the patient with the seizure. Okay. So if the patient with the comes with the febrile seizure means, so you will give the rectal diazepam plus paracetamol or the intranasal midazolam you will use. Midazolam spray will come. So intranasally we will give the midazolam spray and rectal diazepam in the PCM in order to treat and prevent the febrile seizure. Okay, and we are having the focal or partial seizure means the drug of choice for the focal and partial seizure is the very important. Carbamazepine is the drug of choice for the focal and partial seizure. Okay, so if the patient with the seizure comes with the pregnancy means the drugs of choice the levetiracetam is the safest drug in the pregnancy with the seizure. So if she is taking previously on the sodium valproate also, we will counsel that mother to not to take the sodium valproate because it may cause the neural tube deficient and neural tube defect of the baby, the newborn or the fetus which is present inside the mother. So we will avoid the our very important sodium valproate in the pregnancy and we will shift the mother on the levetiracetam based on the the doctor order. Okay, so and we are having the lamotrigine also a good drug with the least side effect in the pregnancy. So but the drug of choice the examiner asking is this one levetiracetam in the seizure with the pregnancy, very important. And we are having the so our status epilepticus if the seizure activity is more than 5 minutes or else if the more than one episode of seizure in the last 5 minutes. So if the seizure occurring without returning to the normal level of the consciousness means we diagnose that one as the status epilepticus means the severe form or the acute exacerbation of the seizure. So we call that as status epilepticus. So in drug of choice of the status epilepticus is the intravenous lorazepam we will give. Okay, IV lorazepam we will give. So because this is a severe and acute exacerbation, we will give the drug intravenously. So IV lorazepam is the drug of choice for the status epilepticus. Very important. Okay. So in case of the absence seizure means the vacant staring spell, the daydreaming like seizure or the seizure with blank expression, that is what we call the absence seizure, which occurs in the 4 to yes 6 month to 6 year babies and which recurs after 20 years automatically. So we call that is an absence seizure. In that seizure, we are having the treatment or the drug of choice is an ethosuximide is the drug of choice for the the absence seizure. And in the status epilepticus, we are having the drug of choice of the lorazepam. Yes, in the febrile seizure, we are having the treatment as a rectal diazepam plus paracetamol IV. Okay. And intranasal midazolam spray also we are having. And in the focal or the partial seizure, all kind of simple and complex partial seizure, we are having the drug of choice as in carbamazepine. Okay. But for all those seizures, it may be in tonic seizure, it may be in clonic seizure, it may be in generalized tonic clonic seizure, it may be a myoclonic seizure, it may be an autotonic seizure. In these all types of the seizure, the drug of choice for this tonic seizure, clonic seizure, myoclonic seizure, or atonic seizure, and the grand mal seizure, that is the generalized tonic clonic seizure in children's, all the drug of choice goes to sodium valproate. So very important, we will counsel the mother or the pregnant lady not to take the sodium valproate because the side effect of the sodium valproate is which causes the neural tube defect. Very important point you have to keep in your mind. Okay, so in case of no seizure from last 2 years, the patient is taking the sodium valproate or other anticonvulsant medications, means the medications which are given to treat the convulsion. So if he is not having any episode of the seizure since from last 2 years, means so he will taper the dose. What is the tapering of the dose? Tapering of the dose means step by step decreasing the dose of the medication. If he is taking the 200 mg, means we will convert into yes 150, 150 to 100, 100 to 50, 50 to 25, 25 to yes no drug. Like this, we will reduce the dose of the drug progressively. So, if the patient is suddenly withholding the drug, means again there is a chance of occurrence of the seizure. So again, he have to take the medications. So in order to prevent this one, we will tapering the dose slowly and we will stop the medication. So don't stop the medication suddenly. We will instruct the patient of the convulsion and seizure. Okay, very important. And we are having the surgical management of the seizure. That is very important. We will study the test which is doing before the surgical management also here. So what we will do here, surgical management only we can do in the simple partial seizure or complex partial seizure, or simply we can say focal or partial seizure. So wherever the abnormal activities of the brain is occurring, so from there we can cut the part of the brain. So that is what we call the brain ablation surgery. See, if the entire brain is involved, means we can't do surgery. We can't remove the entire part of the brain. So if you are removing the entire part of the brain, means the patient will dead. So only the brain surgical management we can do in the focal surgeries. Okay, very important. Okay. So we will remove the part of the brain involved in the seizure production. So that is what we call the brain ablation surgery. Before doing the brain ablation surgery, we will do the ISAP procedure. Very important. That is the intracarotid sodium amobarbitol procedure. See, I will explain what is this ISAP procedure. So in this ISAP procedure, we will do the MEG. That is the magnetoencephalography, means we will identify the site from where this is the brain, so from which part abnormal electrical activities are releasing. So we are identifying the part first by the MEG, and also from the we can identify the the city brain. So it shows the site of the abnormal electrical activity. So consider if the abnormal electrical activities are coming from the right hemisphere, so we have to cut this part of the right hemisphere. Okay, this is what we call the brain ablation surgery. So before doing this brain ablation surgery, we will see the particular opposite part is normal or not. So in order to see the function of the rest part of the brain, so if you are doing the ablation for this, means we will inject the sodium amobarbital. Okay, sodium amobarbital we will inject from how? From our carotid artery, we will inject in the sodium amobarbital. So we will that sodium amobarbital block all the function of this part of the brain for a certain period of the time. So at that time, we will assess whether the body function is occurring or not normally by the opposite side of the brain. So this can manage. This is normal, means so we can do the brain ablation surgery. Why? Because without checking we are doing the brain ablation, means this is also abnormal. If you found after, means the patient may goes to death after the surgery. So in order to check the function and normal ability of the opposite part of the brain before cutting the opposite part of the brain, so you will see the ISAP, we will do the ISAP procedure, that is the intracarotid sodium amobarbital procedure. We will inject the sodium amobarbital through the carotid artery and we will block the function of the ablation part of the brain in order to check the opposite brain function. That is what we call the sodium amobarbital function. Okay, sodium amobarbital procedure. So if the opposite part of the brain is normal, means we will do the surgery of the that particular site of the brain where the abnormal electrical activities are producing. That is what we call the ablation surgery. This is what our nursing management, medical management, and surgical management of the patient with the seizure activities. So if the information is helpful for you, so please do subscribe to my channel, share the videos with your friend. So to subscribe to my channel, you have to click over the button, the logo which are seeing in the corner of the video in blue color. So you click on that blue color and you will get the subscribe button. Please click over the subscribe button. You will get notified for the further videos. Thanks for watching the video. Good luck.